Hi everyone. Today we'll learn about breast cancer or breast carcinoma. Breast carcinoma is the uncontrolled growth of epithelial cells in the breast. This is the second most common cancer in women and the second leading cause of death in women after lung cancer. The breast cancer does not cause any pain or discomfort until they have spread to the nearby tissues. Let us see the anatomy of breast. Breast is a milk-producing gland which sits on either side of the breastbone on top of ribs and pectoral muscles. It contains three main parts. The first is the glandular tissue which makes milk, contains 15 to 20 lobules. Coming to the lobules, there will be a grape-like structure called alveoli, which is the modified sweat gland which is covered by a basement membrane. The alveolar cells secrete milk into the lumen and the covering of the basement membrane, that with the myoepithelial cells which accuse and push the milk out of the lumen to the lactiferous duct and out of the nipple. The second structure is the stroma. Stroma is made up of adipose or fat tissue, and this is the majority part of breast. Along with that, there will be a Cooper's ligament which supports the breast and attaches it to the skin and pectoralis muscles. The third one is the lymphatic vessels, which drains lymph nodes, which contains cellular waste and WBCs and mainly drain into the axilla or armpit lymph node. The cells of the glandular cells contains receptors for hormones, like example in case of estrogen and progesterone, which is secreted by the ovaries, and prolactin secreted by the pituitary gland. These hormones will helps the alveolar cells to divide and increase in number. Without these hormones, the glandular cells will go for apoptosis, that is programmed cell death. Example, after menopause, the estrogen production stops and death of alveolar tissues will be happen and the breast tissue will be replaced by fat. During menstrual cycle, there will be increased estrogen and progesterone level, and after menstruation, the secretion will reduce. So, during every menstrual cycle, the alveolar cells will undergo division and apoptosis. Men also have breast tissue, but they lack the alveoli. So, during each cell division, there may be a chance of genetic mutation which causes tumor formation. And the risk of genetic mutation and the tumor formation increases with the things like increase in the number of menstrual cycle, like when there is early age of menarche, which means the first menstrual bleeding and late age of menopause. Second one is the medication which contain estrogen, which increases the risk. Then the environmental factors like ionizing radiation, like in case of CT and X-rays. And the decreased risk of breast cancer is by early pregnancy and longer time breastfeeding. Also, the breast cancer is linked to the mutations in the tumor suppressor genes like BRCA1, BRCA2 and TP53. These genes will slow down the cell division and makes the cells die if they divide uncontrollably. And when there is a mutation in BRCA1 and BRCA2, it may cause breast cancer along with the familial history of breast cancer when there is a familial history of breast cancer. Also, this mutation will increase the risk of ovarian cancer. Also, another gene, ERBB2, that increases the human epidermal growth factor receptor 2 or HER2, which will be get activated and also promotes the growth of cells. In case of males, the usual cause of breast cancer is by inherited mutations in the BRCA1 and BRCA2 genes. Once the mutation occurs, there will be cell division will be affected, especially in case of epithelial. Cells will get uncontrolled division and forms a tumor, also known as in situ carcinoma. This in situ carcinoma is of two types. The first one is ductal carcinoma in situ, or DCIS, which is a tumor cells grow from the wall of the duct into the lumen. If it left untreated, they will become invasive ductal carcinoma. The cancer cells can migrate along with the lactiferous duct through the pore and onto the skin. That is called as Paget disease of the nipple. This will cause a release of mobility. This will release a mobility factor which helps the cells to break into and settle between the squamous epithelial cells. Also, the inflammation brings the extracellular fluid out of through the breaked skin, and the fluid will get dries and forms crust. The second one is lobular carcinoma in situ, or LCIS. Here, there will be cluster of tumor cells grow within the lobules, and they will not invade the duct, but they will cause enlargement of the alveoli. They does not form invasive lobular carcinoma. Some breast cancer cells have hormone receptors which allow them to grow in the presence of hormones. So based on the type of hormone receptors, the breast cancers can be divided into three major types: estrogen receptor positive and HER2 negative carcinoma, which is the most common type. Then HER2 positive and estrogen negative carcinoma is HER2 positive and estrogen positive or negative carcinoma, and third one is estrogen negative or HER2 negative carcinoma. Then the complications of breast cancer. The tumor can cause local inflammation and damage to the suspensory ligaments and lactiferous duct, and it causes fibrosis of the breast. Then it may invade into the nearby tissues like in pectoral muscles and skin. It can enter and block the lymphatic vessels, and the lymph will get in the interstitial space, which will cause swelling. But the suspensory ligament, they will not allow the skin to stretch out, so the skin will become thickened and dimpled like a podo-orange appearance. Then the tumor cells can spread through blood to the spine, brain and bone, and through the lymph it can be spread to the axillary lymph node and other breast. In case of males, the breast tissue is very thin, so it is very easier to spread into the other parts of the body. Symptoms of breast cancer. There will be hard painless lump or swelling, which is commonly in the upper outer part of the breast. Then there will be swelling under the armpit, and it can be spread into the axillary lymph nodes. Then the breast will become immobile and fixed due to the infiltration of cancer cell into the pectoral muscles. There will be dimpling of skin due to the involvement of skin. Then there will be fibrosis of lactiferous duct and suspensory ligaments that causes retraction. And there may be Paget's disease. If it is present, the Paget's disease, there will be itching, redness or discharge. Diagnosis of cancer. Breast cancer is usually by feeling a breast lump. If the breast cancer is treated effectively, detected early, it can be treated effectively. So for that, there will be regular screening with the mammography in case of high-risk individuals. Then imaging can be done using ultrasound or MRI scan. Then biopsy for the biopsy of the swelling, or a fine needle aspiration and cytology of the fluid from the swelling will be taken. Then next is a Tnm system of classification of breast cancer. Tnm means T means the size of the tumor, whether it has grown into the nearby areas like chest wall muscles. N stands for degree in which the cancer has spread into the lymph nodes, especially in axillary lymph nodes. M for degree to which the cancer has spread into the other site of the body or metastasis. So, this TNM will be ranked from 0 to 4, and also along with that, the combination of substage will be determined by the stage group 0 to 4. Next, coming to the treatment of breast cancer. The treatment is based on the type and stage of cancer. It includes surgery, radiation therapy, chemotherapy, hormonal therapy. Surgery can be of partial mastectomy or total mastectomy. So, in case of total mastectomy, the nearby structures may also be removed. And in case of hormonal therapy, if there is the tumor cells have hormone receptors like estrogen or HER2, then the hormonal therapy can be done. It includes the medications which block the formation or effect of estrogen. So now we will brief out the breast cancer. Breast cancer carcinoma is uncontrolled growth of epithelial cells lining the duct lobules of the breast. It begins as in situ carcinoma. It's of two types, ductal carcinoma in situ and lobular carcinoma in situ. Then over time, the in situ carcinoma can invade into the basement membrane and can form invasive carcinoma, which involves the duct and lobules. Breast cancer can be early identified by mammography. The treatment options are surgery, radiation therapy, chemo and hormonal therapy.